Welcome to Sex Care is Self-Care, a conversation on women's sexual health brought to you by the She Plus Foundation, formerly the Patty Brisben Foundation for Women's Sexual Health. I'm your host, Patty Brisben. I'm coming to you live from the Sex Care is Self-Care studio with four special guests, one in studio or one out of studio virtually and three in studio. So it's going to be a fun day. So are you ready? Yep. Joining me today is Erin Harris, Jessica Dunham,
Talia
Brisben, and one of our very special medical advisory boards, Dr. Christine Vaccaro. Say hello, everyone.
Hi.
Hello.
Now, we're going to start with our very first question, and that is, we want you to introduce yourself to the audience and tell them what you do on a daily basis. So, Erin, let's start with you.
Well, I had the awesome pleasure of meeting you 24 years ago, I think, and now I'm, a working board member for the She Plus Foundation. So the fact that I have the opportunity to pay it forward, empower, educate, and, make women feel like they're not alone is what I live for.
Jessica?
Hi, my name is Jessica Dunham. I am an assistant art director with Cincinnati Magazine, and that is actually where I got to meet Patty. And we did an article about the She Plus Foundation and talking about endometriosis and other sexual health matters. And I'm very honored to be a part of this little board right here to talk about my personal experience with it.
Thank you. And thank you for having us there to be able to do the interview so other people can find out a little bit more about what endometriosis is all about. So thank you so much. And to my left today is my granddaughter. This is Talia Brisben. And I've got to tell you, Talia is the person that has relit the fire. So Talia, you want to tell them a little bit about yourself?
Yeah, so I'm Talia, and I was diagnosed with endometriosis, I think, when I was in like 7th grade. And so I just remember it being kind of a difficult process, and so I wanted to come on here today and kind of share my story and educate people, around my age as well that maybe don't have the same access to healthcare or anything like that, and that's one of my biggest passions. So,
thank you. And Dr. Vaccaro, introduce yourself.
Thanks, Patty. I always love being here on your podcast, and I've been honored to be on your board for the past 4 years. I'm Christine Vaccaro. I'm a fellowship-trained urogynecologist and sexual medicine specialist in the DC area. And on a daily basis, I treat a wide variety of pelvic pain conditions. And I'm really excited to hear about all the unique experiences from our other guests today and share a little bit about the medical perspective. So happy to be here, as always.
Thank you. To start this podcast off, what I found with endometriosis is no two people's story is the same. And it's such a hard thing to diagnose. Can you talk a little bit about what are some of the symptoms of endometriosis and what one may experience to seek help from a doctor?
Yeah, absolutely, Patty. And you're right. No two women are experiencing it the same, but the main symptoms a woman's going to complain of is severe pain with their menstrual cycle. That's the number one, but also there's other things that can happen. Pain with their bladder, pain with bowel movements, pain with sex. So there's a wide host of symptoms that a woman can present with. And I think it can be anywhere from moderate to severe, right? It can be a little bit of cramping with their period. That can still be endometriosis, or it can be debilitating pain where they can't get out of bed, they can't go to school. Very debilitating symptoms. Women can have infertility. I think we're going to talk about that later. And, as a surgeon, no two women are alike either. I can be in the belly doing one surgery and find endometriosis in a woman that has zero symptoms, or I could be going in to look for endometriosis and I find the very smallest amount, but the pain response can be totally different in women. So it's a very perplexing condition. That can occur in up to 10% of women in their lifetime.
So when one goes to their doctor thinking that they might have endometriosis or they're having pain or they're having horrible periods, how do you diagnose this?
This is this is a really tricky part. So technically speaking, to have a 100% diagnosis, surgery is required to take a biopsy to confirm endometrial tissue outside of the uterine cavity. However, we have other good modalities that kind of help us point us in the right direction. So for instance, pelvic ultrasound can find what we call an endometrioma, which is a collection of endometrial-like tissue on the ovary. And that can be has a classic appearance on ultrasound. So that can give us a really good indicator if that's what's going on. In my personal practice, I like to treat clinically, meaning if the woman has all the symptoms, I like to start therapy and see if symptoms improve so that we can try something first before going to surgery. But a lot of women don't respond to medication, and a lot of women need surgery, and surgery is an extremely important aspect of this care.
Amazing. Well, this is why we have our guest on today, because the stories are very different. And so right now we're going to start with Talia. Talia, you want to tell our listeners a little bit how you found out that you had endometriosis?
So I was in middle school, and I remember I would get I started having my period in 5th or 6th grade, but then in middle school my period got really bad, severe cramping. And I told my mom, and at first my mom was like, okay, well, it's the first year or two of your period, you'll come into it, yes, cramps are bad and whatever, but I remember being okay, yeah, this is all kind of normal then. And I just pushed through it, and then I started to puke from my pain, how bad my pain was, and I would feel like I was literally gonna pass out. And so then my mom was and I would call my mom. I never left school. I hated to leave school. And I called my mom and I was okay, I would go to the nurse's office and I had to leave school. And that was when she was okay, something's not right. And I remember I went to see my first gynecologist out of many, but I went to see my first gynecologist, and she told me, she was yeah, and she was so when was your last period? And I was oh, I think it ended last week. And she was okay, well, your uterine lining is 9 millimeters, ready to shed again, basically. And so she was you're having almost 2 periods a month. And I was yeah, I just feel I constantly was bleeding. I was just constantly bleeding, had the worst pain. And so then my mom was okay, well, what does this mean? What should we do? How can we help her pain? And so I started on birth control, and then it was the low lestrin. And then after that, it started to that didn't work at all. 3 months in, and it didn't work. And then after that, I got on the next highest dosage, and that worked for a year and a half. And then my body became immune to it. I went back to the gynecologist because I started having really bad pain again. My body had become immune to that. And then I was on a really high dosage. I think it was 0.30 or 30 or something. And I remember, and I took it every day because I knew that I would be in severe pain if I didn't take it. And I remember I left it. Do you remember this story? When I left my package of birth control at one of my friend's houses. I'd slept over there, and the snowstorm hit Cincinnati, and I couldn't even go get it because she lived down this steep hill. And I was riveting in pain. I was puking all day. I couldn't get out of bed. It was the worst pain ever. And so then I was okay, my mom. But my mom originally, when I went to that gynecologist, she said, she was well, you're gonna need an IUD probably. And my mom was you're not putting an IUD in my 8th grader. I'm so sorry, but that's not happening. And so we did the whole birth control thing, whatever. And so finally, I remember this was around sophomore to junior year. I wrote my mom an essay on every different type of IUD there was. Regular, copper, Kylena, Mirena, what the differences are, how long they last, every single possible thing you could think of about an IUD. And I highlighted the one that I want. I wanted the Mirena. Highlighted it, and she was you know what, at the end of the day, it's your body, you did the research. If this is what you want to do, go for it. And then I went to go get my IUD, and she saw me that she was I went in, and she was so nervous. I remember her grabbing my hand, holding on to me, and she was like, it's gonna hurt so bad. Like it was really brutal pain, and they didn't give me anything. They gave me like a cutie orange, I think, at the end, and that was about all I got out of that office. But anyways, I go in and get this, and like it goes in, they do it. My mom's holding my hand. She's grabbing me tighter than I'm holding her. I'm like, I'm about to let go. So then they put the IUD in, they clip the string, and that's like when like it expands, and it's like the most brutal pain. But it felt like that is exactly like, because cramps are so personable, you can't describe that. But like that is exactly like what like my like really bad cramps would feel like on like the monthly, like. And so my mom, when she saw that, she was like, oh my God, because you can't explain that. Like, you can't describe that. And so basically that's when she was like, wow, like I had no idea. And I like didn't, like, she like felt so bad, and I was like, you can't feel bad. It's not like you knew. And I was like, I thought it was like normal until it wasn't. Until it was, my first gynecologist was like, well, she probably has endometriosis. She's probably going to need an IUD. But I don't know. That's the story there for me.
Thank you for sharing that. You're welcome. Jessica, let's hear about your experience.
So ever since I started menstruating, I had always had, like you said, very horrible, painful cramps. My mom was so concerned, I went through a lot of fainting spells where I would just literally drop and where I was just standing, and she'd be like, what's going on? And I'm like, I'm just in so much pain. And she was like, man, this is really concerning, but everyone says, all women go through this. It's just everyone has pain. It's just normal. But she's like, let's get you with a gynecologist just to be safe. And I went to get a pap smear, and they almost couldn't even perform the pap smear. I was in so much pain just from the speculum. I was like, please take it out of me. I can't do this. I almost fainted there on the table, and they kind of just like left me there and didn't like console me or anything or try to explain any other options to them. They just said, oh, well, that's just natural. You're having really bad period pain. And I was like, okay. So I walked away being like, I guess everyone goes through this. I thought this was completely normal. And they put me on birth control, and I think it staved some symptoms off for a while, maybe a couple years, but I still had really bad cramps. And actually this year, at the end of January, I started feeling, I was like, oh, I'm getting some stomach pain, just normal. I was like telling my parents, I was like, oh, don't worry about it. It's just stomach pain. It turned out it was pelvic pain, and it kept happening every single day to the point where I had to call off work. I'm like, and I, like you, I hate calling off work. I really don't want to be flaky. And I was like, I'm really sorry, but I can't move. I'm stuck in my bed with a heating pad all day. I'm nauseous. I have back pain. My joints hurt. I was like, something's wrong here, but I don't know what it is. No one in my life had ever even said the word endometriosis. I've heard of it, but I thought, no, that can't be me. I'm just being a baby. Like, everyone goes through this pain. It got to the point where I rushed to the emergency room because I thought it was like appendicitis. I thought something else is going on. And when I got there, the male doctor told me, well, you're not on birth control. You need to be on birth control. And I tried to explain to him, I'm not even menstruating, and I'm having this really awful pelvic pain. And he said, well, we're going to talk to your primary doctor. And I was like, okay, go to the primary doctor. Well, I'm not really specialized in stuff like this. You need to see another gynecologist. I was like, okay, can I get into the gynecologist? Oh, it's a 3-month wait because he's a specialist. And I was like, no, we're not doing this. So I made a couple calls. I was like, you're going to push me up. Because during this process, you just have to learn to advocate for yourself and do whatever you can to make your voice be heard. So thankfully, I got to see Dr. Platt Faulkner of St. Elizabeth's Women's Health Center. And the first words out of his mouth were actually endometriosis. And I never heard a doctor tell me that. And I was like kind of scared because I was like, what does this mean? Because I already have a few chronic health issues. This is just another one on top of it. He goes, well, in my professional opinion, after everything you described, the years of pain you've been in, I can't see it being anything else but endo. And unfortunately, the only way for us to know for sure is with a laparoscopy and a fulguration to try to alleviate your pain. So I said, okay, let's do it. I have nothing to lose. I'm tired of being in pain every day. I want to go back to work. So I had a laparoscopy on April 15th of this year. And when I woke up, the first thing out of my mouth was an endometriosis. And the nurse said, oh yeah, it was endometriosis. And I like wanted to cry because it's upsetting because you have to live with this condition for pretty much the rest of your life. But now I actually had I knew where the pain was coming from. I knew how to address the symptoms, and I felt so much relief. My biggest fear going up to the surgery was, what if it wasn't endometriosis and I didn't know what it was? But thankfully, unthankfully, it was endometriosis, and I'm doing a lot better. I'm on my Fembry now. That's managing my symptoms. I've just got off of another flare-up, but I can go to work, do activities. I feel kind of normal again.
Thank you for sharing that. Erin?
It's interesting how many of our stories have similarities but differences. So my experience, I remember I was 13 years old and I was taken out of my freshman year of high school in an ambulance in so much pain. I had no idea what had happened. And at the time, I was being told that I had an ovarian cyst that had ruptured. You know, great, fine, whatever. I had just started menstruating from there. And I say that because I don't think I want to know, like, is endometriosis a singular disease, or does the hormonal changes create other situations as well? So I digress on that. But many, many years of painful menstruation, to the point, again, you can't go to school, you can't get out of bed. Your parents are like, why are you in so much pain? It's just a period. For me, my pain was more in my lower back and my hips. It felt like somebody was prying my hips apart with like a crowbar. Hurt so bad. So at that point, you can't get comfortable, you can't sit down, you can't lay down, nothing. Fast forward, so that was when I was 13. Fast forward to pain through, now I'm 31 years old and I'm in so much pain. They did a pelvic ultrasound, like Dr. Vaccaro mentioned, and noticed I had an endometrioma. So go in for surgery on the endometrioma thinking it's going to be laparoscopic, wake up from surgery, and I had been cut hip to hip. It was so large, it was attached not only to my ovaries, my uterus, my bowel, so they had to disconnect this endometrioma from everything, which then in turn created one of my ovaries not to even function anymore. So at 31 years old, when you're still childbearing age, it becomes a concern. Can you have more children? I know we're going to talk about that. Luckily for me, my functioning ovary still worked, but you go to the next step. You see fertility specialists. You want to make sure that you can solidify that the chances for you, because something likely took that away. So just like everyone else here at the panel, yes, I unfortunately did have to go through some pretty major surgery. And to Talia's point, the pain is the only other pain I can equate it to is labor. Same thing with like cyst rupturing. So when people are like, how does this not hurt you? Your pain tolerance just becomes so great that it's like, oh, this is nothing.
Well, I remember when I had my cyst rupture at school, and I had no idea. And I remember my mom wasn't even like in town or something. She was out of town. I think you got like not in the country almost, or like in a different time zone. But I remember my dad had never would let me leave school. Like, he's like, you're gonna stay in school unless you have a fever or like the flu or something. And I remember I called my dad, and he could even hear it in my voice when my cyst ruptured, because I didn't know what happened. I just thought, oh my God, I just had like a really bad cramp, and I ran to the nurse's office, but I was like flush. Like, yes. I was like in so much pain.
Sweating, probably, wanting to vomit.
Yeah, curled over in a ball, like on this nurse, and people are going in and out like, oh, like can rocking. I have an ice pack? And I'm like, can I get out of here? Like, I was like curled up in a ball on this, like, and so my dad answers the phone, and he could hear it in my voice. The nurse was like, she needs to leave. My nurse was not like that. She was not like, so you need to leave type of person. And so my dad was like, oh my gosh, like, go home, go home. And still, I didn't know what had happened to me yet. Like, I just, like, it felt like the sharpest pain. And I'd had an ultrasound 3 months prior to this, too. It was like 3 or 4 months prior to this. And so when I got home, I remember I drove all the way home. I drove 15 minutes home with my, like, one leg up, like I'm driving, my one leg up, like, trying, because pressure helps. Pressure does help sometimes. And so I, like, have one leg up driving home. I get home, and I remember, like, literally just, like, seeing my couch, and I passed out right on top of my couch, like, face down. and the TV wasn't on, nothing got turned on, the door probably didn't even get shut all the way. And I just passed out, and my stepmom and my dad came home. My stepmom ended up having called the gynecologist when my dad told her that I'd left school, and because she was seeing the same gynecologist too, and so she called, and they were like, she definitely had like a cyst rupture. If she has a fever when she wakes up, you need to like bring her in and anything else. But
I think that's our next pod. That should be a podcast, because we actually had an incident of a cyst rupture happen at Patty's house at a Christmas party years ago. And I was able to diagnose her prior to going to the emergency room because I knew all of the symptoms. She's on the bathroom floor. I know what is happening right now.
And that's something about like everybody, I feel like, that have endometriosis is like, it's so hard to get diagnosed. So it'd be so hard to like get doctor's advice for it. And then, so it's like you're sitting there doing your own research. So when you're doing so much of your own research, you become able to like be like help other people and like see other people around you and be like, okay, well maybe it's this, or like even if you don't even know that you have endometriosis yet, it's like, well, I took 2 Midol the other day and that did something to me, so maybe try that, or like maybe try this medication, or like even like little hacks like teas and stuff that you'll find on like someone's blog.
You empathize with people rather than kind of shut down or question their complaints, I think.
Yeah. I've definitely given a heating pad
Yeah.
suggestions, heating pads, medications. I've had so many people just come up to me now and they're like, I'm just not, like, is this normal? I'm like, no, it's not normal. Like, please, like, you might need to get it checked out. Like, don't freak out, but you need to understand that the pain that you're in, what is it, like 10% of women go through it as well. And it is more common than you think, and it is just good to try to make a community based off what you've learned and what we've learned from our doctors.
You got your hands full today, Dr. Vaccaro. What is your experience with patients who end up being diagnosed with endometriosis? And how different are their symptoms compared to people that you may see?
So I think what we've heard from Talia, Erin, and Jessica is just a wide range of how long it takes, what the pain symptoms are, how debilitating, and what I just want to bring up is how much it's ingrained in our societal fabric to allow women to suffer. It's like suffering is normalized. Women should suffer. Periods are painful, and that's just a normal part. And I think what we really need to do and change in medicine as a society is flip that script and listen to women, empathize with women, treat women the first time, because it can take 6 to 12 years for women to get an accurate diagnosis. And that is shameful. It's tragic. And again, it's because we just normalize pain in women. And when I see a woman who says anything of the following, like, I can't go to work, I can't go to school, I'm in severe pain, I've tried all of the over-the-counter supplements, nothing is working, I'm having severe pain, meaning that I'm, like Talia was mentioning, vomiting, passing out. That's like, none of that is anywhere in the realm of normal and should not be blown off. It needs to be addressed immediately. But again, I think, Patty, the problem currently is women, again, are taught that suffering is kind of just a part of being a woman. And we really need to flip that script, not just endometriosis, but menopause, other pelvic pain conditions. I usually get patients after they've had multiple surgeries for pelvic pain, and then, they're told there's nothing else to do. And then I'm the sort of the last resort. Okay, well, let me send you to the specialist who deals with, pain conditions that no one else can figure out. And these women have been suffering for sometimes decades, and it's we're not doing a great job. You know that. Thank God for you and podcasts and social media and research so that we can advance this.
It sounds to me as though all of these women have found their own support systems, whether it's online or, are being able to comfort somebody in your office or in your friend group. And I'm glad to see that, because it is, no woman should ever have to go through this. No girl should ever have to go through this. And, and now, haven't they made it, I don't want to say a law, but they're offering now medications before getting an IUD because it's painful.
Yeah. Yeah, so thanks for bringing that up, Patty. So there's been a huge, huge push to talk about pain relief for IUDs because, like Talia's experience, a lot of times women are, again, we're conditioned that suffering is a part of GYN exams and procedures, and that we're just supposed to tolerate it. And that's not okay, right? You get a block when you get a tooth removed. You should get pain relief when you're placing something somewhere that's not comfortable. So I'm a strong, huge advocate for medications for relaxation, meaning like Valium or Xanax before procedures, cervical blocks. We can do other things like nitrous gas. There's other medications that soften the cervix. Like there's so many things we can do to make the experience less painful. And I think that's where we're headed. But again, it's going to take a little while for mainstream medicine to catch up to all that.
The term I have for, different procedures that have taken place on myself in the doctor's office with no medication, it feels inhumane to me. Like,
Yes.
To take a biopsy of a cervix
Oh, yeah.
with no medication and just hang on, I'm just going to go in there. I'm just going to literally snip out it's inhumane. I can't describe it any other way other than we shouldn't have to go through that.
I know what you mean. Like I said earlier, when they just left me on the table after I experienced so much pain that I was just sitting there going, this can't be normal. This can't be normal. But they were just like, oh, it'll get better with age. I think at the time they were like, well, you're a virgin, so that shouldn't, that's typical. I was like, I don't think anyone goes through pain like this. And after my laparoscopy, I actually found out that a lot of my endometriosis was on my vaginal chamber. And that's why I was having so much pain during pap smears. And I also found out my uterus is fused to my bladder. And so if I were to ever need to get them separated, I would have to have a complete hysterectomy.
Okay, I'm going to ask this question to each of you. And that is, when did your symptoms, how old were you when your symptoms started presenting? And approximately how many doctors have you seen for this?
So I would say mine started presenting at 13. And then it was officially official when they did the surgery at 31 years old. I, unlike most, had faith in my doctor because, my family had always been to him. He's great. So I went to the same doctor the entire time and was continually told, take birth control. Here's the NuvaRing. Here's the different types of things out there that you can try. And what you just mentioned, I ended up at 37 years old with a full hysterectomy. I am sick of the trauma and the pain and the experience, and I wish I wouldn't have had to do that. It's the best thing that's happened because I don't have the pain and I don't have any of that anymore. But, you lose part of your womanhood. So why not allow us to keep the parts we're born with and just not have to suffer?
Yeah, I would say probably 11, 12. As soon as I started menstruating, I was having symptoms. And I had the surgery this year. I'm 28 now. So that's, about 16 years to get diagnosed for something that's way more common than we're told that it is. As of now, my doctor is in good faith. He doesn't believe I will need to have a hysterectomy anytime soon. Hopefully, like I said, I'm on my Fembry, but I just went through a flare-up again. And when you're in that much pain, you're almost to the point where you're just like, take it out of me. I don't want to deal with it anymore. Like this is making my life worse in so many ways. But I don't know if I want to have kids yet, and I think it's really upsetting that you get that choice pretty much forcibly taken away from you.
How many doctors approximately? Too numerous to count?
Too numerous to count. My endometriosis has also caused me symptoms like anxiety, depression. I've been through numerous psychologists, regular primary care physicians, different, like at least 3 to 4 gynecologists. And a lot of times what they'll tell you is just lose weight too. That'll help.
Everything's about weight
Everything,
loss.
pretty much every single doctor I went to who didn't think it was a gynecological issue, they were just like, just lose weight. And I was like, okay. I was like, I'll try, but I don't see how that's going to prevent me from passing out almost every day from pain.
That's so awful. And also, when you said that your uterus is fused to your bladder, that made my heart hurt for you. So I just wanted to tell you that.
Thank you.
But yeah, I don't know. I feel like I've seen about 6 to 7 doctors, but I remember the first gynecologist I ever saw. She gave me that ultrasound, and I don't remember if she ever saw like she definitely didn't see an endometrioma or anything because I didn't have to get it removed. But she was just like, you definitely have endometriosis. Like there's strong signs, but you would have to get like the laparoscopy to figure that out. And my mom was also like, okay, you're like I was 12. Like she was like, what is happening? She's like, we're gonna go home and you're gonna be like, we're gonna figure it out. My mom was so helpful through everything, and like you were too, and everybody. But so and every gynecologist I saw since her, which like I said was like 6 to 7 gynecologists up until I saw that specialist at Mayo Clinic. But they all were like, yeah, you probably have endometriosis. And I met with Dr. Iglesia too on a Zoom call once, and she was like, yeah, and she actually, when I was just explaining my symptoms to her, she thought, because I had raging lower back pain too. Like anytime I had cramps, the lower back pain would be brutal. And I was like explaining to her a couple other things. And she thought, well, maybe then I had adenomyosis as well, like on the backside of my, yeah.
I got diagnosed when I was going through the fertility review and, with adenomyosis or adenomyosis, yeah.
So yeah, that was my story.
And Patty, if you will allow me, I'm just going to explain what adenomyosis is. So endometriosis, just to clarify, is just endometrial-like tissue outside of the uterus, but adenomyosis, adeno means glands, and myo means muscle. So it's an inflammation of glands inside the uterine muscle. So basically the endometrial glands invade into the uterine muscle and where they're not supposed to be. And then when the lining is trying to shed, it's irritating and inflaming the muscle wall of the uterus. Extremely painful and really common to be seen together. The only way to truly diagnose adenomyosis is on a specimen of the uterus, meaning hysterectomy, meaning the uterus has been removed and the pathologist sees it. So again, a lot of times this occurs after the fact. Hysterectomy is curative for adenomyosis because the organ's been removed, but I just wanted to clarify what adenomyosis was so our listeners aren't confused.
Thank you for explaining that so the listeners out there could understand what they were speaking about. This is going to be kind of a two-part, and I think everybody's going to see that there's a big difference in this panel. So, Erin, I'm going to start with you. What was your biggest concern when you were diagnosed, and what's your biggest concern now?
I think I have two. One, it was just like, am I going to have to go through this pain for the rest of my life? And two, what about having children? Fortunately for me now, I personally don't have a concern because I have removed everything. My concern that remains is my concern for my daughter. Is this hereditary? What are the chances that she will experience what I have experienced? Because the last thing as a parent you want to do is pass anything on like this to your children.
I think my biggest concern, like you, was now that it was diagnosed, the first thing they say is, it's a chronic illness. You're going to have this for the rest of your life. And I was just thought, my biggest concern was, am I going to have a hysterectomy because the pain will just never stop? Like, no matter what treatment I do, no matter what kind of pills I take, the pain will always, and the symptoms will always be there. So that was my biggest concern, was just being able to live with another chronic illness. And another, just like you as well, I think the other thing I was concerned about is if I did decide to have children, is this going to affect my fertility? I've kind of decided I think I'm just going to be a single mom by choice and either go with a sperm donor or adoption. And so if it does have to come down to a hysterectomy, at least adoption's an option. But like I said, no one wants that choice taken away from them. So, and I think my concerns now is just trying to get my life back. I feel like I lost a lot of this year to pain, and I had so many engagements I could have gone to, events I could have gone to. I feel like I missed a lot out at work, and I'm just happy now to be able to feel like start my life again.
We're happy for that too. This is hard. Talia, you're the youngest in this panel, and I know that you've shared some of your biggest concerns. What was it like when you were diagnosed, and where are you at now with this?
I think my biggest concern when I was diagnosed, I mean, you also I was so young too. Like I was like in 8th grade, 9th grade, and so I think it was like, okay, so how are we gonna end the pain? Like, how's the pain gonna stop? Like, and I had no idea that like I was gonna have to go through 3 different types of birth control, and then an IUD, and a cyst rupturing, and all of these things at that age. But I was like, that was my biggest concern, was how's the pain gonna get better? Like this is not gonna work for me. And then I think my biggest concern now is, when you start researching and you're seeing everything, and it's like, I don't know, Dr. Vaccaro, if this is valid or not, but there was like a statistic I saw too of like, I mean, I did so much research on fertility after endometriosis, and there was some like statistics that like 1 in 3 women with endometriosis have at least 1 miscarriage when conceiving, and all of these different things. And like, that is just, I mean, that is like my biggest thing ever. Is like, I want to have kids so bad. I mean, I feel like both of my parents, they got remarried and had a million kids on the side. So it's just like, and I feel like I was older, so like I would come home from the cross practice and like put Estelle to bed, or like just like things like that. And like when they would go out of town for the weekend, like my dad and Ashley, and I would watch the kids all weekend, and like, I don't know. And so it was like, I can't wait until like I have my own kids, and like they look like me, and I'm looking into the same blue eyes as me, like stuff like that. And so that's like one of my biggest dreams, biggest goals. And so the fact of like that not being able to happen, or the fact of just like how difficult the path to get there will be, which I'm willing to go. I'll go through all the terrain, trust me. That's like my biggest goal. But still, it's like, will there be any steps in the right direction when I get to that point in my life, which is like coming up? I mean, I want to like somewhat soon.
Well, you look like you're 12.
I know, I'm 21. I'm 21 years old. But yeah, so like that's like, what steps will there be? What like, I mean, they just started to do medication before an IUD.
Yeah.
There's so much work. There's so many things to happen before like that.
We're behind on research, people. So, and we need it. Am I right, Dr. Vaccaro?
120%, Patty, 120%.
Can you chime in here? And how does endometriosis impact fertility?
Yeah. So I do want to give some ray of hope in one aspect of medicine, and that is reproductive endocrinology and infertility specialists. So those people are magicians. The advanced reproductive techniques that are available now are amazing. So, but let me take a step back and just kind of help understand with our listeners how endometriosis affects fertility. So many people don't know this, but actually when ovulation occurs and an egg is released, it's actually released into the belly. It has to then be kind of sucked up by the tube into the uterus. So it doesn't go like right from ovary to tube. There's a little space in between. And then in that in-between space, the egg, which is a very sensitive cell, it's the largest cell in the human body, actually, it's very, very sensitive though, is impacted by the environment of the belly. And if the belly is really inflamed, which is really common with endometriosis, it's in an inflammatory state, and cells don't like inflammation. So it can damage the cell, or the cell just never reaches the tube to be able to get fertilized. So the way that, and by the way, a lot of women get pregnant naturally with endometriosis. And Talia, I just wanted to make sure I touch on your point. A lot of women, sadly, that have no endometriosis get miscarriages. 1 in 4 women gets a miscarriage. So 1 in 4 pregnancies is a miscarriage pregnancy. So it is a slightly higher, but I just want to make sure that's clear. Also, there's a lot of tragedy that happens to women, sadly. But the way that endocrinologists and infertility specialists can bypass the belly is by doing in vitro fertilization. So That does require, though, injections and hormones and lots of, an egg retrieval. And like it is a lot, but it is a really, really advanced technology method that has really high success rates. So I do want to make sure that women know that. And to Jessica's point, surrogacy is also an amazing option for women, and adoption, right? There's lots of ways to fulfill that motherly desire, and not all two women are going to pick the same thing. And that's why there's so many different options, available. So I do want to give the hope that there's amazing specialists, at least in this realm of medicine, that are excellent. So.
And I will say, Talia, I was told when I went to the fertility specialist I would need help getting pregnant. Gave myself a timeline, said I'm going to make this happen on my own. It happened naturally. I did not end up having to go through any fertility treatments or anything. So once I had that baby, then I was like, okay, we can get this out. Get all of these parts out now.
Dr. Vaccaro, so what is research saying about the treatment of endometriosis now? Again, I know we're behind, and what research really has been done?
Yeah. So, Patty, there's been some really good research. Again, I think this is one area of medicine where we do have some good research. So that is good. And I think we have the best evidence, which we call grade A evidence, about certain treatments for endometriosis. So we know that combined hormonal therapies or progestin therapies have the best data and are the first line therapy for women. And that can be a lot of different things, right? That can be a medication like Jessica was mentioning, which is 3 different medications in Myfembry. It's kind of like one of the newer medications. It has a little bit of what we call a GnRH agonist, which kind of shuts down the system a little bit, so the ovaries can't ovulate, and also shuts down the implants. But it also gives back just a little bit of hormone, so women don't experience like menopausal-like symptoms. So it kind of does a nice little balance. Most women, though, are initially started on, like Talia was mentioning, birth control pills, right? That's generally where most gynecologists are going to say, hey, let's just kind of suppress the ovaries so you don't ovulate and try to mitigate pain that way. Another elegant way to do it is progestin-only pills. That helps decrease inflammation. It also shuts down ovulation and stabilizes the not just the lining of the uterus, but the endometrial implants. And then again, really elegantly, is progestin IUDs. Just like Talia mentioned, the Mirena IUD has the most amount of progestin, which works locally on the tissue. It has been shown, evidence-based, shown to decrease pain related to any pelvic pain condition, but particularly endometriosis and adenomyosis. So those are where we have the most evidence. There's also, the Nexplanon, which is a progestin implant that goes into the arm, just underneath the skin, and that also has decent evidence to show its benefit. The sad part, though, is we're still just sort of like, we're treating the symptoms, we're not preventing the disease, right? That's where we need to go in medicine. Like medicine 2.0 is, how can we identify, right, whether based on genetics or family history. Like Erin was mentioning, the family history is concerning too, right? We know that at least there's like a 5 to 7 times higher rate of endometriosis if you have it, that your children are going to have it, female children, obviously. So we need to do a better job at figuring out who's at risk, and then figuring out prevention strategies rather than just treating pain once pain's occurred. And we're not quite there in medicine. That's where probably we need to do a better job, honestly.
I agree. I do agree. After hearing these stories.
I'm sorry, let me mention one other thing, Patty. And I think this has been touched on a little bit, but there's lots of other therapies, right? Not just hormonal mitigating strategies, but, ibuprofen, naproxen, other medications that help with nerve type pain like gabapentin, other non-narcotic type pain can also be used for this. And this idea of central sensitization, so meaning how the brain reacts to pain, has come up a lot recently. We know that about a quarter of women are not going to be responsive to either hormones or surgery. And that's because of how the brain and the nerves interact with the pain experience. So these patients really need a team approach. They need other medications that help with nerve pain. They need to learn about, the experience of pain. So there's education about how we experience pain. They need a behavioral health, provider. They need a pain management specialist. And again, it's this whole team that really is needed to take care of those patients. A MIGS trained gynecologist is extremely important to have on the team. So that's a minimally invasive gynecologist who specializes in endometriosis care. That's kind of like the team leader of the team, especially for patients that are not responsive to medication or surgery.
I'm telling you, finding somebody who is going to help you put this team together, I can already tell you, is not easy. It's not.
Nope.
All right. What would you say to the listeners who are experiencing pain or just received a diagnosis? I'm going to start with you, and then I'm going to ask each one of the panel.
Yeah.
What would you want them to know?
Yeah, so just like sort of mentioned, making sure you find that leader that's listening to you. And generally, that's going to be a specialty gynecologist that specializes in endometriosis. Starting with your primary care to get a referral is fine, but just making sure when you're doing your research, you're getting someone that specializes in endometriosis surgery. Because again, you want to have a provider that has all tools available to them. An accurate diagnosis is really important, right? As we mentioned, there's lots of ways to diagnose this, but generally surgery with a biopsy is the definitive way. So that way you have a diagnosis. Having photos, I find, is really helpful for patients that have been suffering too. Again, I don't want women to suffer, but most of them have been suffering, right, by the time they get to me or other surgeons. And just showing them pictures of what is going on in their belly is super validating, right? A lot of times they've been told that it's normal or everyone should experience pain, blah, 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 gaslit. So I love showing photos and validating their pain experience. And if you're considering surgery to find answers and you're not wanting pregnancy in the future, it's a really nice time to get a progestin IUD like a Mirena, Kyleena, Skyla, et cetera, placed, because again, although Talia is super tough and strong and did it in the office, a lot of women aren't going to be able to tolerate that very well in the office. It's a nice time to have another treatment modality placed, right? So if they're going to take a look in your belly at the same time while you're under anesthesia, it's a nice time to place an IUD to have something that's going to be a little bit more long acting and helpful. And then another big thing that I get referrals for a lot is patients that are have had a hysterectomy with their ovaries and tubes removed, and then they're immediately in surgical menopause. And although they've traded their pain is now improved. Now they're experiencing the debilitating effects of menopause, which is very, very, very difficult, especially surgical menopause, because it's so abrupt. So making sure that you have a hormone plan for menopause management if you're seeking what we call like the definitive surgery, which is hysterectomy with removal of the ovaries. Make sure you're not trading pain for hot flashes, night sweats, debilitating, sleep disturbances, mood changes, et cetera. So just making sure you're covering all the bases so you can live your best quality of life, pain-free and without devastating hormonal deficiency symptoms. Woo!
That's not
Hopefully that was
Erin?
not too scary.
I think what I would want to say to anyone who's recently being diagnosed or experiencing pain is communicate what you're going through to the people that are the closest to you. Don't hold it in. They will help you find others maybe going through the same thing. And I think, like we've all discussed, it's wonderful to have somebody near you that can kind of give some insight. This worked for me, this didn't work for me. And I'm really excited to hear the improvement in the research that's taking place, and the medication that's available just wasn't available to me at the time. I mean, one of the processes my doctor took was to put me on Lupron, So it forced me into menopause for 6 months at 25 years old. So menopause for 6 months, try to reset your hormones, I believe was the goal, and didn't work. So just all these random life experiences, but talk to people, and we have to continue to get the word out that this is real.
I would say probably the biggest thing is you're not crazy. you're not crazy. Your pain is real. Your pain is valid. I know it's very hard to go from doctor to doctor and pretty much be told there's nothing you can do about it, but you have to learn, as I've learned, you have to be, and you've said, communicate with others, advocate for yourself, and also when your pain is valid, don't feel bad for having to take a break or to have accommodations. If you push yourself in this pain, you're only going to feel worse afterwards. And it's okay to take a break and try to see what's going on with your body and take time, to see your doctors. It's so important that you just take care of yourself.
There you go.
I think I would go off of those 2 points and say the same and say, there's so much more research to be done and that's needed. And I think, your pain is valid, but also I feel like what I would have wanted to hear back then was just you're gonna get through it and it's gonna be hard, but you're gonna get through it and you're going to be okay and you're going to take all the right steps as long as you advocate for yourself and you take care of your own body and everything. And so I think that's my biggest piece is you will be okay and you will get through it. You will cross the finish line eventually. And when everything's said and done, you're seen by so many people, more than just the 10%.
I really want to thank this panel. You guys did an amazing job. I know you were a little bit nervous going in. And Dr. Vaccaro, you're amazing. And I'm just really lucky that you were all here today. And I hope there are listeners out there that this can help. But if you like what you heard today, please rate and subscribe to our podcast. For more information on the She Plus Foundation at www.sheplusfoundation.com. Remember, sex care is self-care and sexual health matters.